Welcome to Med Madness, where we dive deep into the medical and ethical dilemmas that shape our practice. Today, we're exploring a critical and often complex issue: ethical considerations in multiple gestation pregnancies, specifically focusing on the principle of maternal beneficence. Beneficence is the cornerstone of medical ethics, encapsulating the physician's obligation to act in the patient's best medical interests. During pregnancy, the primary patient is the mother, and her health and well-being take precedence in medical decision-making. This prioritization becomes especially significant when maternal and fetal interests conflict, a common occurrence in pregnancy. Consider the scenario of a triplet pregnancy. Multiple gestation pregnancies, such as twins or triplets, inherently come with higher maternal morbidity. Women carrying multiple fetuses face an increased risk for complications such as preeclampsia, caesarean delivery, and postpartum hemorrhage. The challenges extend to the fetuses as well, with heightened chances of growth restriction and preterm delivery. Given these risks, patients are often presented with a difficult choice: continue with the multifetal pregnancy or undergo a procedure known as pregnancy reduction. This procedure involves inducing a systole in one or more fetuses to reduce the number of fetuses, thereby lowering the pregnancy order to, for example, a singleton pregnancy. The selection process for the reduced fetuses is typically random, in contrast to selective termination, which is based on specific fetal traits like sex or chromosomal abnormalities. The decision to proceed with multifetal pregnancy reduction primarily hinges on the principle of maternal beneficence. By reducing the number of fetuses, the maternal risks associated with high-order multiple pregnancies are significantly decreased. The likelihood of preeclampsia, postpartum hemorrhage, and the need for a caesarean delivery drops considerably. Although there are potential benefits for the remaining fetus, such as improved odds for term delivery, these are secondary to the primary goal of enhancing maternal health. Another ethical principle often discussed in this context is justice, which emphasizes fair and equitable treatment. Justice involves ensuring the equal distribution of medical resources and avoiding discrimination. However, in the case of pregnancy reduction, the driving force is maternal medical benefit rather than matters of justice. It's also important to differentiate between the principles of nonmaleficence and beneficence. Nonmaleficence focuses on the avoidance of harm, whereas beneficence requires actively adding benefits. In the context of pregnancy reduction, upholding nonmaleficence would mean opting for expectant management, refraining from the procedure due to the inherent risks involved. However, the principle of beneficence, aiming to ensure the best outcomes for the mother, often guides the decision-making process. To illustrate these concepts, let's consider a real-life case study. A 32-year-old woman, already a mother of two, finds herself pregnant with triplets. Her obstetrician explains the heightened risks associated with carrying triplets: severe preeclampsia, potential for caesarean delivery, and significant postpartum hemorrhage. Additionally, there are concerns about the fetus's health, including the risk of preterm birth and growth restrictions. After thoughtful discussions with her healthcare team, and considering her personal circumstances, she decides to undergo multifetal pregnancy reduction. The goal is to reduce her pregnancy to a singleton, thereby minimizing her risks and improving her overall health prospects. The procedure is performed, and although it's a difficult decision, it's made with the understanding that the primary aim is to safeguard her health, embodying the principle of maternal beneficence. This case underscores the complex and often heart-wrenching decisions faced in multiple gestation pregnancies. It highlights the importance of ethical principles in guiding these choices, ensuring that the best medical interests of the mother remain at the forefront. Thank you for tuning into Med Madness. Join us next time as we continue to explore the ethical and medical challenges that define our practice. Stay curious, stay informed, and stay compassionate.